Good afternoon. I'm Sheila Malcolmson, British Columbia's Minister of Mental Health and Addictions. I'm joining you from the traditional territory of the Songhees and Esquimalt First Nations. And along with thousands of family and friends who've lost loved ones during British Columbia's toxic drug poisoning crisis, I grieve the many, many lives lost during the overdose emergency. I'm here today with Dr. Bonnie Henry, Provincial Health Officer, Lisa Lapointe, British Columbia's Chief Coroner, Mike Knott, an activist with lived experience, and Senator Larry Campbell. We are here today to mark British Columbia's next step on preventing toxic drug deaths. Despite our government investing in addiction treatment and prevention at an unprecedented level, for example, over 100 adult treatment beds opened this year. We've doubled the number of overdose prevention sites and supervised consumption sites since 2017. Our First in Canada Prescribed Safer Supply program has had a 475% increase in take-up. We've shipped 1 million naloxone kits. Just this Friday, just days ago, we opened the 105-bed Redfish Healing Center on the former Riverview lands. It's for the treatment of complex, concurrent mental health and addictions. Despite this and more, we have lost thousands of lives. The expansion of services is historic. We've never asked our public healthcare system to do more, fighting 2 public health emergencies, rolling out an unprecedented vaccination campaign, and working hard every day to save lives. People on the front line, social service organizations, non-governmental organizations, peer workers have acted heroically to save lives. And yet, tragically, we continue to lose lives at terrible levels. Some days, especially after the effects of the pandemic and pandemic-related measures, increasing drug toxicity and exacerbating the overdose crisis. As the coroner has noted, some days we are losing 6 people a day to toxic drugs. Even though we're adding so many services, we continue to see so many deaths. Despite all this innovation and all this determination, we have not ended the public health emergency. And so we must do more. And today represents the next step for British Columbia in tackling British Columbia's overdose emergency. Once again, we are taking up a toll that no province in Canada has. Today, we applied for an exemption to Health Canada under Section 56 of the Controlled Drugs and Substances Act to remove criminal penalties for people who are in possession of small amounts of illicit substances. Substance use and addictions is a public health issue. It is not a criminal justice issue. By decriminalizing people who are in possession of a small amount of drugs, we will be removing a barrier to health and treatment services. I hear that shame and fear keeps people from accessing life-saving services and treatments, and shame and fear can make people hide their drug use and use drugs alone, and especially at a time of terribly toxic supply. Using alone can mean dying alone. As the coroner has noted, people are dying alone in their homes, often with their family and friends, having no idea that they were struggling with addictions. And that's why today's application is crucial. A dedicated and thoughtful group of stakeholders and partners helped build our application to Health Canada, including health and social service organizations, Indigenous organizations, people with lived and living experience, municipalities, law enforcement, advocacy organizations, and clinical and research groups. Together, we look forward to Health Canada's response and to working with the new Federal Minister for Mental Health and Addictions on an urgent basis. As we proceed with next steps, we will continue to work with our local partners throughout the province to make sure decriminalization is done right. Meanwhile, British Columbia will continue to build new treatment and recovery services and fixing a deeply fragmented system that was neglected for 16 years. While we pursue decriminalization, we are also tackling the toxic drug emergency crisis on all fronts. We're continuing to add overdose prevention sites, including for inhalation. We've announced the next phase of prescribed safe supply, expanding access across British Columbia. New access points, but also new medications. We will keep expanding our medication-assisted treatment program, including using nurse prescribers who continue to enroll. Again, a first in Canada option. Ordinarily, nurses can't prescribe anything, but they can prescribe medication-assisted treatment in British Columbia. And last month, we announced $132 million to invest in addictions treatment and recovery across the continuum, and filling gaps in the continuum of substance use care, including 195 new substance use treatment beds for adults. This is on top of doubling youth treatment beds, which is already underway. We're working every day to help people stay safe and access the supports that they need. There is more to do, and we need to use every tool in our toolbox. There is no magic bullet to end the drug poisoning crisis, but decriminalizing people who use drugs is essential to stemming the tide of the toxic drug crisis. It's essential to removing the stigma around drug use, which is itself vital to ending overdose deaths, and to building a more comprehensive system of mental health and addictions care for British Columbians. Thank you.